It's a room that you came to last year.
Yeah, that's one of the questions.
Okay. Looks like it's working.
Just keeps coming.
Yeah, more stuff in there.
Maya, thanks for coming. Was there any problem this morning? Okay. I didn't want to take a chance after not having a session for 3 weeks and figuring some power outage or some unexpected thing would blow up.
How are you?
Okay. How about you?
Fantastic. Didn't smell, so I was happy.
Some coffee?
I'd love some coffee. That sounds great.
Alrighty.
You need these cups again?
Excellent.
Maybe I would do open meetings a little gross after sessions. I like this.
Well, so I started doing distance running, but I've never really run my entire life.
Yeah.
So I'm getting was it plantar fasciitis, and now I can't wear my brown leather shoes anymore.
Oh, no.
So-
How far were you running?
I'm up to 6 miles.
Okay.
So, but yeah, no, I mean, it started as literally as soon as I started to try and run as a 40-year-old. My body's like,
So are you able to run through the fasciitis that you can still run?
A friend of mine who's a skilled distance runner sent me to, there's a running store by Green Lake, and they make custom inserts.
Oh, you do inserts there. That's a great store. I've been there. Yeah.
Fantastic. I put them in.
Jack and Jill?
No, it's behind the bike store.
Roadrunner or something?
Something like
I
that.
think it's Roadrunner, yeah.
I'm great.
And really just, as soon as I put them in,
Yeah.
the issue was resolved.
Yeah.
Well, you're lucky because plantar fasciitis can be very painful.
It was no fun.
Tough to
Yeah.
do, yeah.
Wake you up at night.
Well, then, fortunately, we addressed it as soon as it showed up.
So now you're doing 6 miles. That's great.
I got to work my way up to 13.2 by April. So.
Good for you.
So what are people saying? Did I see the speaker? Speaker in the corner. Okay.
Speaker in the corner.
He'll be next door in case things crash. Drew was here. Must have been here when you arrived.
No.
No? But he had it set up.
Yeah, it was already set up.
Okay.
So.
Should I put on a mic or it just catches?
No, yeah, there's just a mic on the podium there.
That's great.
But also the ceiling ones, right?
Yeah.
Are live.
Mm-hmm.
Usually the only time we have audio problems, we have women who have soft voices.
Oh, okay.
And then people text me from my
We
phone.
can't hear them.
Yeah, we can't hear the speaker.
I would have to leave right around 8 o'clock and make it to it.
You do?
I have an 8:30 lecture over at UW. That's
The main campus?
on the health sciences, so I'll just hop out of here, Dave.
That's fine. Everybody else does as well.
Yeah.
Unless I tell them we're going to have an extended session.
Okay.
So I only do that sometimes with out-of-town guest speakers.
Sure.
And then I'll have a fellow present a case, and we'll sort of make a second hour of teaching rounds, but I haven't done that this year.
Okay. Well, I didn't overload the slides because I'd love to. I had a recent case that I wanted to talk about, and then some of these new controversial issues of microbiome and things. I'd love to see what you guys are thinking about.
Indirectly, we approached that. There was a New England Journal paper maybe 2 months ago that compared farming practices of the Huttites and
And the Amish. Yeah.
and suggested that had a lot to do with protection of the Amish.
Right.
That was, I think, the last time the session came up.
Yeah.
Where the issue came up.
Who I guess they're the same genetically, except the Hutterites use machines and the
Modern farming.
practices and the Amish
One of my colleagues will be coming with a printed copy to hand out. So we should be good.
They announced
So
it
I was
as
getting a
decided.
little worried at the end of last week when I couldn't reach you.
For some reason, the emails, we were talking to Francis, and
Text to the name.
something about the emails weren't getting to me.
Don't go.
From me or from her?
I think
I mean, it's
both. I was looking for anything from you.
Both boys.
Nice.
Could be the UW
3 to
server or
5?
something, but I was
The
searching.
only ones in school yet.
Yesterday I searched for anything from you or from her, and it just, we were coming up.
Did you independently know you had this session?
We had talked about it, and so I had something in the books, but I hadn't, but I hadn't seen anything recently about it.
Well, the thing
So
that's
very glad you reminded me.
the thing
And
that's
I will
so
tell
was,
the world.
you know, I was writing to you, I was leaving your voice. Did you hear my voice
We
message?
started with
Yeah, those were, so.
But then finally, I went by
I'm glad you found Vicky, yeah.
Yeah, that was crucial. So at the last moment, I said to
I'm like,
another person who's somewhat in the loop on this, a woman named Tina, who works for private medical office. She said, I still haven't heard from her. What are we going to do? And she said, well, I said, well, he's been a speaker before. This is unusual.
Yeah.
She said, well, let me look back to the last time he was a speaker. And she
What
found
service did you
correspondence with
Yeah, it's called cultural
Vicky,
care.
is that her
Vicky,
name?
yeah.
And then that was critical
it's
because
about
she got back to
Vicky
me.
just texted me right away.
Yes.
Daycare.
So it's,
And,
I'm glad we-
40% of the cost.
Something was weird was going on with the UW.
And you don't have any of the
Look for those.
insurance.
Like I said,
and employment issues.
something's going on with those emails. So
When we first
we
went
straightened it
here.
out. So Francis sent me something yesterday and it got right to me. So don't know if somehow the email got changed or something. We have
It all worked out. But
It all worked out,
I've been
yeah.
running these sessions for a long time, so
Yeah.
like anything in life, I know that anything that
So
can
my
go
buddy,
wrong.
go wrong.
This will go
Two
wrong.
girls.
They'll forget to bring food.
and after
the power
employment
outage,
insurance
yeah.
and everything, so there's about $55 a year they were paying.
That's good. You get it.
And
People
they're
used to
like,
get nothing.
you know,
At 7 for the.
that's a lot.
Yeah. Hey, Mike, how are you?
Good morning. I'm
It's
good.
on Texas.
Yeah?
A little chilly.
Yeah? You growing
So
up?
I slipped on the sidewalk.
Is
Coming
that
out of
right?
the car,
Ah,
yeah. It's ice.
Ice on the
Yep,
sidewalk.
yep.
Wow.
And I have a
It's not-
car
What's more to
that I let
Yeah, I might
Take whatever you want.
Right.
I won't report you.
Okay.
Oh, that's right.
Disclose this.
So really. Bear with me here.
That's, but yeah. And the quality of care is astronomical.
That's
Mike, can you sign?
One adult and a kid.
What's it, a 10?
Daycare,
Yes.
most other
Yeah.
settings. You'll never find it.
one. I really have
How do you
Company's
up to
having a
Seattle?
speaker meeting. Sorry to interrupt.
Going to Phoenix?
Yeah, you go there too?
I'm not going,
Oh.
but you'll have some fun.
When you go?
21st.
I'm going to be there on Wednesday.
So it'll be good.
Okay.
I'm trying to think. Season 1, so all of the speakers are going to be retrained. And I don't know because I just went to a meeting last week and they were saying that a lot of
Good.
people that are in
I slipped on my ass on one of the
doctors
sidewalks.
know about 643, but not the general community. So there might be some more talking points for you guys.
Well, I haven't been trained before. I haven't even been paid to train.
I thought I paper trained you pretty
What's
well.
that?
We're talking about speaker training for
Oh.
the product.
And then the other thing too is, if you can give me some dates that you're comfortable with in the Seattle area, and then maybe, yes, and then,
How are you?
yeah,
So remind me.
okay, perfect. So I need these two. And
I had
then,
a guy recently who came to me and said, no one diagnosed.
oh, it's the gentleman in the red.
Morning. How you doing?
Very good. How are you?
Yeah,
Yeah. And his insurance guy, I wrote a letter saying,
and so I actually just got word yesterday that it's going through the process, but Monday, then Martin Luther King Day, we probably won't run that next Tuesday.
So, okay. Yeah, it disappears after a while, so you really have to.
I'm retired now. I thought about it. Yeah. Well, too many gray hairs. Problem.
Awesome, thank you.
Didn't look like this 10
Well,
years
have
ago.
fun.
But I earned it, right?
I'll do it.
We were actually in
You're a tap
Yeah. How about you? You're on vacation.
Go down Atlanta for us.
Oh, you took to Atlanta?
We went to the playoffs to the Alabama Husky game.
Oh, nice.
That was really fun. So we decided to make a little vacation out of it. It was really fun. I was Atlanta.
That is how we,
But
sleeping in it.
Yeah.
that's okay. We're like a mess.
That's what happened for January 1st.
Yeah, the usual.
All downhill.
I don't know why that is. They just did.
I was not happy about it. It's just temporary. So I think Kansas goes already. Yeah, trouble. Did you guys know?
I went to Panama. My daughter had a semester abroad.
So I got called about that last week. Sorry, I didn't tell you because they told me, oh, we're not going to do you. I went to the hard day. With the hard irritation.
I've never been there.
Yeah.
Did I know that?
Oh my God.
Besides that,
I'll let her know.
No. We
I bet it's
and
pretty
a half day
amazing.
watching two together, but there are a lot of surrounding areas.
No, I saw her like on Thursday.
I just did it in the yellow one.
But,
Because you get points for getting
In the last 2 days,
they were really adamant about that.
it was
Still
built
an allergy.
for
They were like, oh, no, we're just going to have to get this done.
I brought my golf club. So I told him, 2 days in a row, they came back the next day to do it.
Yeah, well.
Oh,
Mike was sent an email saying, should I reserve a spot on that one? He always gets the golf course.
Oh.
Oh, look,
Yeah.
Lombardi and I talked about it. It's just,
Has to be
we
the first
decided
time.
ultimately, these centers, they have to go to that was the other thing we were
Bob, how you doing?
There was about a process to it.
Yeah, and it's like even if the skin type is
you're
negative,
really
what then
Yeah, but this is
But I would say that. So
you started.
I took like
Adults about desensitization.
very like I got to the website and she's
doing.
yeah. So there's a 6-week lead once you say you've interviewed someone, you say yes, I like you. They say, yeah, I like that person. Then there's 6 weeks where they fly in, they do their training. Yep.
Okay. Might be easier.
Right here, that's the only problem with it, isn't it?
Why would you do something?
Around all this. These are mainly in the morning.
I guess Jake
Right. Dressed. Yeah, go to the front door. Go dressed. But now we're straight here. So all I do is I sort of wake up, do oh, yeah.
So I used to like correlate last time. Oh, I just still figuring out.
Oh, well, thanks for yours.
So if they decide they want to do unison or amp, can I just tell them to do it? Initially, I was like, should we skip test, but
So Mary, do you know why it happened? That trip to Panama was my tropical trip.
Did she tell you? I ran into that in the village.
Yeah.
You look tan.
So like,
Well,
we're from Panama. I just have to put in the order. That's
Oh, we're down there.
10 days.
Or wait, is it between your tan and the suntan?
No. And I put on sunscreen when I play golf.
All right.
Regardless.
Well,
Just say whatever you want.
good. She looked happy.
I don't know.
I forgot.
She took care of it.
Wow.
Yeah.
There's some new
Rockstar that they brought in.
Yeah.
So I'm,
Oh, I bet you're happy.
Great, yeah, I'll be around. I'll walk in.
I know. Thank you.
Yes, I know. Yeah.
Weird.
that's Friday, day and night. You are in your regular rotation then?
David, if you're over in Tel Aviv listening, Happy New Year. Well, Gary, hopefully you got up. I hear Drew tells me you couldn't get here. It's icy or either that or you're sleeping in. Lazy. First question is, I didn't finish watching the football game. Did Clemson actually win
Yes.
the game?
Last 2 seconds.
Really? Yeah.
2-yard pass.
Amazing finish.
Such a good move.
I know. I'm glad.
All right, well, there were some struggles in pulling this session together. I was concerned that the broadcast wouldn't work. I hadn't heard from the speaker until Saturday. I thought I was going to have to go to Plan B, and I had no Plan B. It wasn't looking good. But anyway, it's all come together. Peter Rabinowitz here from the screen here, Center for One Health. I think he'll re-explain what that is. In the Department of Environmental, Occupational Health Sciences, and Global Health here. He's going to talk today about animal allergy and the hygiene hypothesis. Thanks for coming.
Thank you.
Parking was very hard this morning. I don't know, I have no solution for that, other than bike.
Well, good morning, and it's good to be here, and I'm glad Len found me to be able to show up for this talk. And what I wanted to do was, I've talked to this group a couple times before about animal allergy, and I want to sort of talk about some recent developments in the field, and talk about a case that I've had in the past year. I'm, as Len said, I'm in the Department of Environmental Occupational Health Sciences. My background is I'm a physician with training in occupational and environmental medicine. So like all of you, we care about things in the environment that could make you sick, and I'm kind of trying to figure out what to do about it. So I have a clinic at Harborview where I see workers, and I have a case from there I'd like to talk about. And I'd like to then talk about how that relates to this whole issue of exposure to animals, both at work and in the homes, and whether animal exposures are a good thing or a bad thing, and whether animal allergy is something that, like other allergic conditions, we have to think about, is it only that we should be avoiding all the exposures, or should we think about the timing of exposures and how to possibly have a kind of a healthy set of exposures for people through their life cycle, and what that means in terms of managing side effects like allergy. So, and how that relates to the developing science about the bacterial microbiome that is living with us all the time and helps probably determine some of our responses to the environment, including our allergic responses. So I'm going to try to present this case, talk about some of the big issues, and I'd also be very interested to hear what sort of clinical issues that you're seeing in your practices that relate to this kind of subject. So I don't have any particular disclosures. As I said, I'm going to talk about some general animal allergy. I'm not going to focus as much on allergy in the homes. You all see cases like this and probably know more about it than I do, but I'd be happy to discuss what I know about it a little bit in terms of animal allergies. And then we'll talk about the hygiene hypothesis and how that relates to whether exposures to things are good or bad, and how the microbiome could be part of that, and where practice could be in a few years. I think we're rethinking some of our ideas in the occupational medicine side, and I'd be interested to see how allergy and immunology is thinking about these things. So again, as an occupational physician, we think about who is at high risk for potential diseases depending on what kind of exposures they have. And I'm going to talk a little bit about lab animal workers, which is a large, not insignificant group of workers in Seattle, and probably a growing group of workers and we see a lot of them around the university as well. Farm workers are people who regularly contact animals. Some of them grow up on farms, but more and more we're dealing with farm workers who have probably moved to this country, have never really been around a lot of animals before, and then in their adult life are now encountering animals for their first time. People who love animals go into the veterinary profession sometimes, and they often deal with allergies that may be really affecting their ability to continue their profession. Even if you're not in the veterinary care, there is a large section of people who are employed in all sorts of things that we do with animals, such as pet parlors and pet stores, who, again, can have some very intense and unusual exposures to animals and animal allergies. And then I know some of you here, because of our proximity to Alaska and some of the large fisheries and cannery situations, have been involved with exposures to crab and shellfish, which you all know can cause allergy, but when you work in a factory with hundreds of thousands of clams or crabs a day, you can have some, again, very unusual occupational exposures to shellfish types of allergens. And then people who work with sort of exotic animals and rehabilitation and zoos and things like that also have some unusual things. So these are things that often come to the attention of occupational people, and I'm interested to see how often you see that in your clinical allergy practice. So this is a patient I saw a few months ago, and it just brings up some of the issues of allergy in the workplace. And this is a woman who had been working in an animal laboratory. She was a laboratory animal technician in a laboratory, and she had gone to her employee health department complaining of facial swelling. Previous to that, she really had no history of occupational allergy or any problems that she had gone to clinical care about related to her work. And she had all of a sudden one day developed just a facial swelling. She went to the employee health department. They gave her Benadryl. She got a little better, and they sent her home. And they were then concerned that she was going to have worse recurrence of these kind of symptoms, and they sent her to us. And basically what had happened on the day when she was exposed is that whereas she was often involved with feeding animals in little cages and changing their bedding inside a hood, she had to go outside of a hood into a washroom where there was a big, just a utility sink where you had to dump all the cages and dump the bedding out. And it was when she was covering for a person whose job it was to do that kind of dumping without a hood ventilation, that's when she developed this facial swelling. So being around animal lab was nothing new for her. That was really her job for the last 15 or so years. Again, her job was to feed the animals and change their bedding, but she usually did that in the hood. She hadn't ever seen an allergist, but she sort of thought, yeah, I kind of have some seasonal allergies, and just occasionally taken a little over-the-counter medication for it, but I've never seen an allergist, been tested or anything like that. She also said that about 3 years ago, at that time, she was not using personal protection all the time. She was not using an N95 mask. She was just doing her work. And she had an episode where her chest started feeling tight. And she, without going to any medical person, decided that this was time to start wearing a N95 every day as she did her job. So she never had a workup, never been diagnosed with asthma or anything like that, and had not been treated. So on exam, she definitely had rhinitis bilaterally. She and a little bit of rhinorrhea. She didn't have any rash. She didn't have any facial swelling. When I saw her, she was not wheezing in any way. So, any ideas what you would order on somebody like that? In your practice, if someone came to you with those complaints, would you just be interested? Would you go right to skin testing? Would you do RAS testing, or what would you?
What kind of animals were in these
So
cases?
So she was mostly taking care of rats and mice and occasionally rabbits. And 8 hours a day, 15 years, predominantly rats and mice, and then rabbits.
I think we skin tested.
The skin test and the skin testing. What rat and mouse things do you have in your usual skin test battery?
Frank?
What's that?
It's epithelium.
It's epithelium. Okay. And do you have a rat and a mouse epithelium and a rabbit one if you needed that? Things like that.
What was the bedding? I mean, it was a biologic product?
It's a biologic product. I'm not exactly sure. I think it's a pine chip bedding, but I'm not actually totally sure on that. It's a good question.
Well, because I've had patients who have rabbits, but they're not allergic to the rabbit. They're allergic
to the bedding.
Like bedding or the feed, alfalfa grass.
Yeah.
Yeah.
So, and I don't know how you feel about non-allergy practitioners who don't have access to skin testing readily, but do RAS panels. We have access to those, so that's what I did on this lady. So I did labs that she did have a microcytosis, kind of consistent with thalassemia, which turned out she'd been diagnosed with. Her white cell count in her diff was normal. So I sent it for a RAS panel and a total IgE, and you're welcome to criticize the management in terms of getting RAS panels, but I did a Northwest allergy panel on her, which was positive for a number of different things that they put in the Northwest allergy panel, like alder, birch, hazelnut, Johnson grass, oak, and timothy grass. So I don't know how many of those would be in the bedding. But in terms of the animal allergens, she did have some reaction to mouse epithelium and rat epithelium, but in general, actually, mouse epithelium, not really as much to rat epithelium, but her most significant reactions in terms of the IgE RAS levels were the mouse urine and the rat urine. And again, I'm not sure how much you make out of absolute differences in the IgE, but her most pronounced one was to mouse urine. And rabbit epithelium was definitely negative. So at this point, we know that she's allergic to something in mice and rats as well, and that if she keeps working in an unprotected situation, she's definitely going to be exposed to the allergen that caused her to get sick in the first time. And as occupational people, we have to look at the fact that this is this woman's career. She's an immigrant without a lot of English skills. It would be hard for her to get another job easily. So it's not easy for us to say just go and get a job working in another career. This is what she knows how to do. So would you allow this woman to continue to work? And what protections would you do for her? So any thoughts about that? If you think about the picture going on here, there are these potential allergens, and as Len said, you can think about both the animals themselves as well as the environment, both the bedding and mold that grows on the bedding, and even insects and dust mites that could be in a situation like that. We think this is a common, often unrecognized problem. Some studies have shown up to 30% of lab workers develop allergy at one point. There's some risk factors. If you have atopy, that seems to be a risk factor, smoking, history of allergy to bird animals. And certainly estimates have been that not only do lab workers develop allergy, but they also develop asthma. So one of the concerns, of course, of this woman is that her disease could progress if she continues to be exposed. So
that's a critical question. I see a fair number of people here in a different issue who are work for the seafood processing companies here, and they develop. Actually, we don't see crab workers' asthma anymore. It seems to have disappeared. But you see people who are allergic to finfish that they process. Drew knows about this as well. Yellowfin sole, pollock, and
really?
Yes. And I've always been concerned. I've told these companies that someone on the model of red cedar asthma, also a Northwest problem, where there was data showing if you let people continue to work, they may get chronic lung disease that's irreversible. Right. That any of these models of occupational disease, if they have asthma, it's probably unwise to let them go on and continue to work, or at least they have to have very good protection, because otherwise their disease might progress. You might have litigation, you might get sued that you let people go on and get chronic lung disease.
Yeah.
And I'm just wondering what you know, what happens in your clinic about that.
Well, so one thing you bring up is the red cedar issue. Red cedar is something that causes asthma. It also can cause hypersensitivity pneumonitis, and that, like other types of hypersensitivity pneumonitis, like pigeon breeders' lung from being around pigeons, or bird fanciers' lung from being around parrots, as you said, does create this problem of potentially irreversible granulomatous lung disease that leads to fibrosis. Are you going to risk that with somebody? So when it comes to things where they seem like they're developing hypersensitive pneumonitis, we tend to really often get somebody out of the workplace. I had a patient who was working as a receptionist in a veterinary clinic, and she kept being hospitalized for pneumonia, and the veterinary clinic specialized in parrots and parrot-like birds, and she kept being hospitalized for these sort of bilateral little atypical pneumonias that then would get pretty much better after a few days out of the workplace. And she'd go back to the workplace, and it would happen again. And it turned out that she was getting recurrent hypersensitivity pneumonitis. She was getting bird fancier's lung just working in the reception area with all these parrots and birds coming in. And at that point, she was a candidate for a lung transplant by the time that she came to care, because she just developed so much fibrosis. So you don't want that to happen. When it comes to a situation like this, where they're going to develop asthma, you are in that situation of, can you change the natural history by early removal, or are they going to go on to develop asthma? So this patient does not yet have clinically diagnosed asthma. I've actually set her up for a methacholine challenge, and she didn't show. So I'm trying to figure out if she has any evidence. She's not had any exam positive wheezes or anything like that. But it's a dilemma. You don't want someone to lose their job and be overcautious, but you don't want someone to develop worsening complications of a condition. So any other thoughts you would give to somebody like this if they came to your practice? Because it's certainly possible they will. And I actually referred this patient to an allergist for sort of a second opinion.
Just out of curiosity, did she present during the pollen season? Just for fun. In other words, was her
given the
airway-
pollen, I would say she presented in August. So would you call that the pollen season here?
Well, not really, but you could argue she was at the end of it, maybe not well treated rhinitis. So it would have amplified her.
And that would have amplified her
response.
But how about the facial swelling? Would it have predisposed her to the facial swelling?
Well, I mean, in other words, it's a circular argument, but theoretically, if she had a lot of inflammation and so forth from unblocked, tree and grass season, granted that's at the
more
end.
for the job would have been worse.
Right.
Yeah.
When you first saw her, she had a history of asthma, but you didn't say that you did a spirogram on her when you first worked her up.
She had a history of an episode of chest tightness that she treated herself by putting on a mask. So nobody had ever diagnosed her with asthma.
So then you didn't spirogram her initially.
So I did not spirogram her initially. In our clinic, we do not have spirometry there. We have to refer them to pulmonary for pulmonary function. So I've referred her, and she hasn't shown up yet.
It goes back to why the original presentation of facial swelling, not a usual symptom, nothing else, no sneezing, itching, rhinorrhea, whatever.
Yeah.
What do you make of that?
Well, I think she, again, some limited English speaking. I think if you're working in a job, you minimize your symptoms sometimes. So I think that definitely when she came in, she had some rhinitis symptoms, but she is the kind of person who doesn't like to complain, I think. So but certainly it was when it got bad enough to have facial swelling, that's when she came in.
Did she handle the bedding itself, or the?
So in that case, she was dumping it into the sink, and there was this basically cloud of bedding that
She
was
doesn't
coming
touch
out.
her face with her hands or
And
anything
she
like
had everything else covered pretty much. And the only place that she really was swelling was the place that was uncovered. Any other recommendations you would have for her work?
How good is the hood?
So the hood is pretty good. She says she can keep working and it doesn't bother her. She can go back and work in the hood and wear her N95 things. So I don't know how often you deal with work restrictions and things like that. But it turns out that if you tell people and write them a note saying you can do your work, but there's certain things you can't do, you are restricted, and it's a medical restriction, that sets off some problems with the Human Resources Department because they're considered to be having a work-related condition that is causing a work restriction. And it goes on their sort of OSHA log as a continuing problem. So what I had done with her was I said, look, she can continue to work in her usual job in the usual animal rooms, but she cannot cover for that person in that washroom with that big cloud of bedding periodically. But she can do everything else, but she is restricted from going in the washroom. And what the supervisor came back and said is, I don't want you to say that. I want you to say that she has to wear basically a PAPR, which is a positive air pressure supplied respirator. So basically a respirator thing all the time with supplied air that's always continually blowing out, so she can't breathe in stuff. So basically walking around with sort of a motor and a supplied air situation like that. And therefore, she wears, as long as she wears that, she's not restricted in anything. She can go in the washroom and do the work. So there's where you really have the workplace saying, put this kind of contraption on her, and then don't restrict where she can go, but she can walk around like that. Partly because it's what shows up on the OSHA log, depending on what you say. So these are the kind of sticky things you can get into in the workplace where it would certainly make sense for her not to work outside the hood. And I'll just, mention a couple of dilemmas about these occupational exposures. They've found that in some situations, workers working around a higher level of animal allergen seem to have lower rates of asthma and allergy. And could this be simply that these are the people who are genetically less susceptible, or is there sometimes more of an allergen creating a little bit of protective IgG response or something that reduces your rate overall of allergy? There's also the question about whether exposure to endotoxin, which is present in a lot of animal workplaces, and endotoxin is the lipopolysaccharide from gram-negative organisms, but they found that people who have high levels of endotoxin, it can not only be an irritant and it can be inflammatory and it can cause some airway inflammation, but it potentially can also induce some protection against the development of allergy. It's one of these funny things where these environmental exposures can both induce inflammation, but they may also alter the immune response in some ways. So how do we prevent things in occupational workplaces? This is what industrial hygienists who are engineers who go around trying to make workplaces safer think about things, and it's probably similar to the way you guys think about reducing exposure risk at times, where the most effective thing we think is to get rid of a hazard, just to, if there's animals around, get rid of the animals. Otherwise, if it's an allergenic animal, like a mouse, have them work with rabbits, which may not be as allergenic. Then we do engineering controls like hoods, administrative controls like me telling them that they cannot have that person work in a certain area. And then we think the last resort, ideally, is to go to something like a PAPR respirator where you have to walk around with a contraption all the time. So we do not put masks and things on people for their whole work day if we can avoid them to do something else more basic to eliminate it. But eliminating hazards is not always easy. If you work in an animal lab, you cannot really get rid of the animals when you do. And how should we follow these workers? There really are no mandatory standards. There are, again, hundreds and thousands of workers in Seattle working in animal situations like this. There's no OSHA standard that says they all need to be screened either with spirometry or allergy testing or anything like that at baseline. There is some recommendations by OSHA and others that these people have some kind of baseline skin testing or some type of baseline spirometry, but that is not the norm in any workplaces like that around Seattle that I know. And I don't know if you know of any different ones. And then once they've started work, this woman had actually been filling out a questionnaire periodically saying she didn't have any problems. People do that because they don't want to lose their job. How do you find out if people are developing early signs of allergy in the workplace like this? Given the fact that people don't always want to complain, and this woman even had an episode of chest tightness for which she altered things but never told anybody. So should people have repeat allergy screening at some point? It just really hasn't come into the workplace yet, but you would have to think about, maybe it's something we should think about in the future. So this woman, at the moment, having been confirmed with IgE testing that she's allergic, is not on regular medications, although she does have some antihistamines to take when she needs it. I gave her an EpiPen. I'm trying to get her lung function evaluated, and we're trying to continue to tell management that she doesn't need a PAPR all the time. She just needs to stay out of the washroom. But we do want to follow her closely and see if she's developing any worse signs of allergy from that. And sometimes we give people peak flows and have them keep a diary and see whether on a work day her peak flows are changing at all compared to not changing. And we use that sometimes to try to understand if the workplace is a cause of airway variability in someone who we suspect might be developing occupational asthma. So just mention sort of another situation with animals where you have a farmer who is who grew up not on a farm but in the city and now wants to be work on an organic dairy farm and be around animals and sustainable lifestyles and milk and things like that, is developing a chronic cough and is referred by the provider for a possible animal allergy. And could this be allergies or could it be something else? There's a lot of things around a farm. There's hay. There's the mold and bacteria that grow on the hay. There's everything, all the pollens, all the other plant allergens that are around there. He does notice that cough gets better away from work, and certainly there's these allergens, but then there's also a lot of exposure to things like endotoxin on a farm as well. And one of these contradictory types of evidence that we're getting is that when you look at rates of both animal allergy and asthma among dairy workers and other animal farm workers, so people who you think have definitely higher exposure to animals than the general public, you also have lower rates of animal allergy as well as lower rates of asthma in some studies among these workers. And kind of why is that, and what should we make about that? We also know that these people have, again, higher exposure to endotoxin, but that endotoxin, as I mentioned, might be a cause of lower rates of allergy. And how should we approach that situation if a little bit of endotoxin might be good for you, even though too much endotoxin can both irritate and inflame your airway, and if it's a lot of it, causes this thing called organic toxic dust syndrome, where there's just so much inflammation from this exposure to endotoxin and similar things that can just really cause a pneumonia-like picture from so much organic material, especially endotoxin. And that relates to this whole question of hygiene and whether we call it the hygiene hypothesis or just how we think about what is clean and what is not clean, what is an exposure in the environment that could cause problems, what is an exposure in the environment that could cause good things, and realize that, as in this situation, there's exposure both to allergens as well as certain sort of chemical compounds like endotoxin, and then there's the exposure to microbes as well. And what's the right mix, and what's playing the biggest role when we think about the kind of environments? And as we're realizing more and more, that it's a mix of allergic proteins and things like that, and it's also certainly direct irritants, and then there's the possibility of microbial exposure. And an ongoing issue. I know there was this article in the New England Journal a couple months ago about the Amish and the Hutterites, with finding that the Amish who did traditional farming practices may have lower rates of allergy compared to the Hutterites who use more modern industrial farming practices with less use of animals. Is there anything about this exposure to animal allergens that's actually protective against animal allergy? And as you know, there's also this question of if you are born in a household that already has animals, you may have a lower risk of asthma from growing up in a household like that.
So, stop you there, because we started to discuss that before he stood up to speak, and what the community, if anything, what we're doing.
Does anybody come to you for counseling about this?
Yeah, I mean, you tell pregnant women to have dogs in their house.
Yeah.
But, have we translated any of this into advice for people, or something we believe firmly enough that we should change? I mean, I pretty firmly myself believe that early life exposure to dogs probably would be protective. And there's enough evidence for that, but I don't tell patients that unless they volunteer it to me and say, well, I heard about this, what do you suggest? Does anybody really change their practice about animals in a home before birth of a kid? Just like, the same question's coming up, is anybody translating peanut evidence into what we do with food? It's somewhat the same question of prevention of allergy.
And I guess, I'm also a family physician, so I'm getting all these emails about the early introduction of peanuts to, that I should be thinking about that with my patients to make sure they're getting exposed to peanuts in the first 6 months. Are we going to change our attitude about animal exposures in a similar way at some point, and why, and what kind of evidence would it take to do that, and how would we manage that, because it's just a little different from the way we've done things before. So I think these are just...
Take it from that silence, it's a no.
Yeah, what kind of discussions, are patients coming up with these? This is Seattle, everybody reads the internet all the time. Are they coming to you with these questions and asking for your opinion?
I'd sort of go along with what Len says. If the conversation goes in that direction, you say, dogs, there's been data to show they're protective.
Yeah.
There isn't any data to show cats are protective, just dogs.
Yeah.
So if you're going to have them, I wouldn't get rid of your pet. But at the same time, you got to think whether you're really going to get one, because the data is not that solid, whether you can protect them.
No.
And then when you say that some of the studies show that animal exposures protect you, I think it's not in adults. I think that's only in kids. So I think when you have this farm worker moving out at age 25 to go on a farm, I don't think that data is going to protect him.
We don't have that data at this point. I mean, when you look at adults on farms, they've looked at kids on farms. When you look at adults on farms, you see the same pattern. But a lot of those people grew up on farms, and you don't know as much about what happens when someone like that goes to a farm. They certainly have not had that early childhood resetting of their immune system, so they definitely could have a different. And then how are you going to handle that?
I mean, I think often for me what comes up is like a 3 or 4 year old, and they're tested for other reasons, maybe that they don't have pets, and they're sensitized based on testing.
Right.
Well, is it okay to introduce one? And I don't know. I sort of arbitrarily decide on the size of the skin test and the size of the patient. In other words, figuring if it's a 10 millimeter in a 3-year-old that's with a tinier airway, it's more likely to have negative consequences. That sort of, but there's no hard data, whereas if it's like 3 or less, that sort of thing. I think if they have the ground rules with a gradual little exposure, in my experience, they're often tolerated with no trouble. And then I think you get the positives.
Yeah.
But it's that fine line.
So you'll find a high level of sensitization in a kid who there's no animal in the house.
Correct.
They've somehow gotten sensitized to it.
Yeah. The other kicker is often, of course, when a question comes up, one or both of the parents is allergic to cats or dogs.
Right.
And the other parent wants to get it. They're like, I'd rather have the animal than my husband, or something. Kind of thing. So that gets a little like, no, I'm staying out of that.
It's a difficult choice.
I got an outside question. What was the rationale for your prescribing the EpiPen with a patient who had respiratory symptoms, but presumably it's not stated here, that sounds like systemic anaphylaxis?
So that's a good question. I think it was to be a little bit on the safe side, given the fact that they'd had facial swelling before, and we certainly did not have documented anaphylaxis at that point, but I think it was the idea and to be just a little bit safe against the worst thing that could happen given the fact that this person had an episode of facial swelling. Maybe that was overkill.
That person would be at risk for being bit by the mouse or rat if she's handling them too, so you get a systemic absorption of the antigen. When I was a fellow, at the NIOSH, there was one of our fellows was working with had rhinitis and was bit and had like a 60-point drop in systolic blood pressure within a minute. So you're getting a very rapid absorption of the antigen with
in a sensitized person. Wow.
So anyone like that, I would prescribe an EpiPen.
Yeah. And one of the interesting things about, I actually went to her workplace and took a look at the washroom and the room where she usually worked, and the supervisor who took me around said, by the way, she herself had developed pretty severe animal-related asthma, and so now would not herself go within closer than a few feet from the animals, and was self-managing without, again, really telling management about it or medical people skeptical about it. But she knew that if she went close, she would really start wheezing and have severe airway problems if she got close. So it's probably more of it out there than we think, although the ventilation is getting better in a lot of these workplaces.
So does that woman wear a PPE or whatever that thing is?
Yeah, right.
You know?
It was not her that was pushing the papper. It was the overall sort of HR supervisor for the whole unit. So I just want to put one more twist on this question, which is we've talked about the role of allergens. What about the role of sort of germs and bacteria in this, and how are you guys thinking about the microbial side of environmental exposures and allergy? Is there something about the communities of bacteria that live with us that could be affecting this whole picture? As you know, the human microbiome is what we're sort of calling all the bacteria, fungi, protozoa, and viruses that are kind of part of our ship going through life here. They sort of live inside and on the human body. There's many more of those microbes in our bodies than there are human cells. And we sort of didn't used to know quite as much about them, and we had a hard time culturing them, and therefore it was hard to identify the fact that they were there. We kind of thought that if they were there, they were either sort of doing not much and just part of the normal flora, or occasionally they became pathogenic, but we just didn't think about some of the facts that they could really be playing an important role in our physiology and our state of wellness or disease. As you know, our ability to sequence sort of everything for the DNA that's around has really helped us kind of understand the microbiome. Especially a lot of studies at this point are still being done by looking at the 16S ribosomal RNA of bacteria, which varies between bacterial species, and it provides a good sort of little coding strip to be able to tell what species of bacteria they are. So you can take a big sample of whatever in the body and look for all the different types of bacteria and their different abundance and things like that. And people have been then really looking at this idea of microbial communities that are somewhat different in their makeup, depending on whether you're talking about the gut, the skin, and things like there's not really here, there's the nostril, but we're also starting now to look at the lung as well, so that when we think about things like asthma and inflammation in the airways, is that related at all to the bacteria that are there, which we didn't really think were there even much before. We know that the gut microbiome is now really being thought of as another organ, where if you don't have it and it's not functioning well, that can be a real problem. And if yours isn't functioning well, should you get a transplant, a stool transplant or something like that? And if you get a stool transplant, what do you get with it that could be something you may or may not want? We know that if you have chronic C. diff colitis, being able to reset the gut microbiome with a stool transplant really seems to work. We're looking at that with inflammatory bowel disease and other things. But we really think that the gut microbiome is playing a major role, not just digesting food, but also really synthesizing things like vitamins, playing a role in a lot of different metabolic pathways, metabolizing drugs, and having some definite immune system input as well in terms of both activation and support of the immune system. And that's the gut. But the gut is in communication with a lot of other of the microbiomes in the body. As I said, we're looking at it definitely related to a lot of these GI types of diseases. There's some evidence that if you have an obese mouse and you transplant the microbiome from that mouse into a non-obese mouse, you can induce things like obesity. So there's other types of metabolic syndromes that may come with microbiome communities. But what about something like allergy and asthma? There's a recent paper that brings up the fact that studies have shown that the lung microbiome, and again, we used to think of the lung as a fairly sterile place unless you got a pneumonia or an infection or something like that. We now know there's a definite communities of microbes there, and that the microbial community in the airway of an asthmatic is different from the microbial community of a non-asthmatic. And as we think about managing airway inflammation and asthma in the future, should we think about manipulating these microbial communities as part of our management? And what does that mean to manipulate a microbial community? We know that things like lactobacillus in the gut can alter the microbial community and things. Is there any corollary of this in the lung, and are we going to think about that? And could this have any relationship to this questions about things like the hygiene hypothesis, or when you introduce exposures to certain things in the environment to manage your allergic conditions? And related to that, there is some evidence that if you live closely with animals, you may actually share some microbiomes. There's been studies where you look at people who are living with dogs versus not living with dogs. It turns out that the microbiome of certain parts of you, certainly we've seen that in the skin and the relationship between the microbiome on someone's hands and the microbiome of the nose of the dog in the house is much more similar than the nose of a dog in another house, that there's been continual exchange of bugs between the dog's nose and your hands, and that kids may have an even more intense kind of sharing of microbial communities with the animals that they're living with. Could some of this types of bacteria be shared in a way that could affect that kind of asthma development and allergy development that we're talking about? And there's a study in Arizona going on where they're taking people who don't have dogs and randomly giving them dogs to see if this changes their microbiome and affects their development of allergy, rates of allergy or control of asthma and things like that. So should you eat yogurt or should you get a dog? That's one question. And I think we really do not know this at this point, but they are starting to look at these sort of things. So we know that we're starting to look at certain recommendations for a healthy microbiome. There's certainly been some evidence about C-sections versus vaginal births, and if you have a C-section, should you have some way to introduce the vaginal microbiome to the baby at an early age to protect or to stimulate a healthy kind of immune development? Same with breastfeeding. Does that really have a beneficial effect through a microbiome type of thing, and the types of microbes that you're helping to develop? Social exposures to sports, instead of playing video games all the time, was it actually a good thing that people went out and had wrestling matches and had lots of contact with other people and their skin microbiome and other types of their microbiome? The amount of time we spend indoors versus outdoors, and the diet, antibiotic use, obviously. But are we going to start developing a sort of a list of healthy things to do for your microbiome that may or may not involve animal contact? I think that, again, the jury's out about that, but I think our understanding has gone a lot beyond just sort of, if you develop allergy, get rid of the animal. How do we think about the pros and cons of this kind of contact with animals? So the One Health idea, Glenn said, I was going to just mention again what it is. It's the idea that when you deal with something like animals, you deal with the fact that there's a lot of medicine going on for those animals as well. We have a whole kind of parallel medical system developing for animals, and should we kind of work together with what we know about animal health and the people taking care of animals to try to figure out some of these issues, like, are animals good for us or bad for us, or when should we get rid of the animals and when should we not get rid of the animals? So the One Health idea is that we should, instead of having human health over here with their hospitals and things, and animal health with their veterinary hospitals and allergists and different specialists, there's animal dermatologists practicing within a few blocks of here and things like that. Should we all kind of be working together collaboratively for the health of all species that involves the environment as well? And related to that, has anybody contacted a veterinarian in dealing with any animal allergy issues? It's not something
it's there.
My vet keeps asking me when I'm going to come and teach him how to do allergy testing on his animals.
Well, there is allergy testing going on for animals, and as some of you probably know, animals suffer allergies, so cats can become allergic to people, and that can be a real issue for the allergist, the animal veterinary allergist to be dealing with. Is that apparently human skin dander can be allergic to cats, and so definitely then are you going to get rid of the spouse to keep the cat happy?
According to my vet, it's dust mites and then grass and then foods is what they're really interested in. They didn't talk about testing for human owners.
Yeah, but apparently I've heard from vets that human is one of the issues they deal with sometimes. So.
Drew skin tested the big gorilla at the zoo.
Yeah,
he was sensitive to dust mites.
The dust mites. Yeah. So that's and it's got chronic sinusitis, right? Mm-hmm. Gorilla at the zoo. So.
What's he doing?
He's doing well. Yeah.
Yeah, he's giving the nasal
Yeah, he's getting
Yeah.
To be a speaker next
so,
yeah, that's right.
Is there going to be more advantage to some cross communication between? And one thing that I do think you're going to see is veterinarians doing more allergy testing, and then telling the owner your animal is allergic to this in the environment, that environment, so that people may be changing their household environment to help the dog or the cat. As you probably know, there are more dogs than kids in Seattle, and people are seeing the animals as more and more valued parts of the family. That they pull a lot more weight than they used to around the family in terms of medical decisions that are going on. And you've got this group of practitioners who are starting to move into this whole issue of allergy testing and I think that's going to be interesting. They are also dealing with a lot of cat asthma. Cats probably get the closest thing to human asthma of any other animals, and as cats are indoors more, they're seeing a lot more cat asthma. And are they picking up on risk factors for humans in the household as well? So you may be getting a call from the vet. But I think the issue beyond this pure focus on allergy is the issue about potentially learning more about the microbiome. Again, animals, sometimes they try sort of new age things on animals before they try them on people. So a lot of veterinarians are giving sort of treatments to animals to affect their microbiome and are swearing by it. And whether it's bogus or not, I think we still have to determine. But I think you'll be hearing again about more of that. So is anybody hearing, just a couple questions that have come up, anybody hearing about hypoallergenic pets, or what's the latest you guys are hearing about that? Because
patients come in all the time telling us certain breeds or dogs are hypoallergenic. I don't know where they get this information.
So I'll tell you my understanding, and you can correct me if you've heard something different, is that there are all these dogs that don't shed as much. But as you know, the feline allergen and the canine allergen are generally not skin allergens as much as either salivary or sweat-related types of allergens. So that shedding less does not correlate with the amount of allergen that they're actually producing. So that this poodles actually produce more canine allergen than Labrador retrievers. I have a Labrador that sheds all the time, but that Labradors apparently produce less canine allergen than a poodle. There is a cat that's been bred for low feline 1 allergen production, but has anybody seen anybody buy one of those? I think they're really expensive still.
I thought it was a sham. The guy was indicted by because it was not.
One of them was a sham. Yeah, I don't know.
He tried to get a FLV1 knockout cat, but it was bogus.
It was bogus, so there's really no definite.
He made a lot of money though before
before he went to prison.
But like you, I've seen so many people swear by their hypoallergenic dog and things like that. But as far as I can tell, the vets are still feeling there is no truly hypoallergenic.
It was an abstract about 3 years ago at our national meeting where someone had compared the major dog allergen in 6 different breeds, one of them being the dog that Obama had,
Portuguese
water.
Portuguese water.
Yeah, which was not low. The only one that was lower were guide dogs for the blind, and they had no idea why that was, but it was the only one that was statistically lower. But other breeds that are promoted to the public as
Those are different species. It's not only one species that they use for the blind.
Yeah, they thought it had something to do with the animal's personality or discipline or training, and didn't have anything to do with their biology. They didn't really have a credible answer. That was just with the data.
Dennis Unby, he had a paper. They did blind challenges in occupational room, and there was no difference. I mean, they all induced the same effects. And
Between
they took 5 different hypoallergenic thought to be breeds versus 5 others.
Well, that's the latest I've heard too, and it's amazing how the people are spending a lot of money for that.
And the other thing is when they've done whole gene analysis of dogs are like 99.5% identical across species. There's only like 5 different gene traits that are different between all the different species, from the Chihuahua to
the different breeds,
Great Bernard. So.
That raises a completely unrelated but fascinating question.
It's like monkeys and humans.
Why do dogs that look so different from one another, like when you're walking your dog and it's tiny and there's a Great Dane out there, they know that's another dog. They don't think it's an elephant or something. So,
how do you know?
That's amazing. How do
do
dogs recognize one another and know?
It's a dog and not a
secret bar.
That was just a random thing.
They analyze the gut biome, the gut biome at the other
Yeah,
end.
it's actually the microbes.
That's
microbes
right.
recognize
Here's another pragmatic question, just a difference in practice between the university and what we do. And I think Bill, for example, over here, if you're going to immunize somebody for cat allergy over here, they use a whole vial of 5 ml. It's just a very pragmatic question between allergists to be an effective immunotherapy. We put 2 ml in at our practice, and we'll dilute it with other things. And the question is, do we have any data on how much allergen we need in cat to be efficacious?
We had got, our clinical pharmacist, Ryan North, and I, maybe 5-10 years ago, we went through the different relevant articles and tried to just make it evidence-based. So we found the ones that had good efficacy for cat desensitization, and just the cat allergen is less concentrated, so that's why we had to use the whole thing just to make it dose-related.
What do you do at the Everett Clinic?
We use 4 cc's of cat in a vial and mix it with other stuff, but we make sure we put 4 cc's of cat in there.
So it sounds like we undertreat.
Well, no, I think the 2 is figuring it's going to go in a 5 cc vial, so it's diluted down to 40% of that times 0.3 is at the level that Hal Nelson has published. So, having said that, personally, I add more if there's room in the in the antigen, figuring it can't hurt.
And I think if you're getting to the point with a case where you're talking about really telling them to give up the pet, it might be used. Might be one time to see if the veterinarian has any other ideas about how to manage the pet around the house to reduce the exposure that a person in the house is having.
Well, that's the point. The small so-called hypoallergenic dogs. My personal suggestion is buy a dog you can wash in the sink every week.
Yeah.
And those are the little non-shedding dogs that we had a Havanese, and I said this is relatively hypoallergenic, but it's because it's small size and you can put them in the sink and wash them.
Yeah.
Otherwise, you can't do that with Labrador.
Yeah.
You get a
Well, or
Labrador
it's
in the lake and you get washed every
another
day.
way of saying a clinical allergy is, how big your skin test multiplied by exposure.
Yeah.
Right.
Yeah.
And so, to your point, it's if you compare equal levels of antigen, they probably have the same result. But if
it's a little
right.
teapot dog and teacup dog, and you're washing it twice a week, regular washing does seem to reduce allergen load.
When you give people advice, do you ever talk about just mechanical things, like try and make like a laminar flow room where they would do their animal washing and animal changes instead of saying you got to just pull this person out of their occupation?
That's why we would much rather manage the environment and help a lot of people, because what's going on right now with my patient is that she's working in her room, but there's still a person in an unprotected, there's another worker who's working in this unprotected washroom being exposed to this high level, who right now is not complaining, but is at increased risk for developing something. So I'd much rather that they improve the airflow there. That's an expense that the company doesn't want to do right now. They'd much rather pay for a little respirator, which is actually cheaper than putting in an airflow, but it's much better for them to put in the airflow. So we really try to get someone in that. We really feel that in the workplace there can be an economic incentive to fix the environment, and we try to do that wherever we can.
From a medical legal standpoint, I've been sort of coached by the attorneys that if there's no airway involvement, then the case is really not very interesting to the attorneys. But when you have an asthma component to it, then all of a sudden it's taken very seriously at that point.
And that's why I'm trying to get her tested, even though she has not wheezed or she has not come to care as an asthmatic. If I could show that she has an airway component, I think the workplace is also going to take her more seriously.
Your peak flow chart sure looked pretty.
Well, that was not hers.
Yeah, that was the same person.
That was hers. That I think.
Okay, that's great. That looked pretty positive.
That's right.
So basically, just to summarize, this, animal allergy. I'm sure you're all dealing with it. It's a big thing in the workplace as well. But we have to really look at when are these animal exposures overall beneficial for our patients and in workplace as well. What's the microbiome doing? I think this is a rapidly changing field, and we're going to keep hearing about how the microbiome is playing an effect on development of allergen and the natural history of allergic disease. And basically, moving forward, what's the best balance between the exposure and health in terms of other things we're looking at to keep healthy microbiomes as we continue to evolve as a species ourselves in a more developed, urbanized world. How should we have animals as part of that and other things in the environment as well? So, see how the next year develops for the literature, but I think it is a rapidly changing field. And it's great for me to be able to talk to all of you and hear the latest you have. And if you have any questions about anything in the workplace or anything else related to animal exposures, feel free to contact me, and I may be able to connect you with some people who do this a lot.
Well, actually, a very pragmatic question. How do we get patients into your clinic if we have something that interfaces between occupational medicine and allergy?
So I just see patients at Harborview every week, and you could just call the Harborview Occupational Medicine Clinic and come to see me there. Love to see them. Or just call me up. Great.
Thank you. I'm not worried about the chicken pox because it's
Question. I staffed a consult through, and we were talking about possible behavioral with asthma, eczema. It's an end-stage renal FSGS patient with ESM. And there are no suspicious heroes just done vaccine. He was talking about having them see I guess he has dramatic care now, so I think they were a little bit down. He was thinking maybe
Right. It was a big knot. It didn't go away.
Stretched out. Yeah. I don't think it's going to he's going to repeat. Get it.
Like that.
I've never actually been. It'll be my first time.
Have you ever seen anybody that really got bad?
Oh, okay.
You can actually
This is like to the sites where kids
Oh, I didn't mean it in a bad way.
So I'm just in her history. I'm just
You should.
But that's
Erase
never come up
that.
again.
Yep, shut gone.
It doesn't